Hello friend, today I will discuss about the topic of pharmacovigilance. Topic name is types of the adverse drug reaction or adverse event. First, what is mean by adverse event? Adverse event is the any unwanted, unfavorable medical occurrence that may be present during the treatment with the pharmaceutical of the pharmaceutical product, but which does not necessarily have a causal relationship with the treatment, is known as the adverse event. Next, what is mean by adverse drug reaction? Adverse drug reaction means any unwanted, unwanted or any nauseous changes which is suspect to be due to a drug occurrence at dosage normally used in a man required treatment or decrease in the dose or indicate causality in future use of the same drug is known as the adverse drug reaction. Therefore, adverse drug reaction is an adverse event with the causal link with a drug. There are the various adverse drug reaction or adverse event such as nausea, vomiting, headache, depression, body pain, allergic condition, vomiting, mood change, mood swing, etc. First, then see classification of the adverse event. The first type is classification according to or depending upon the one set of the event. They further divided into three types: acute event, subacute event, or latent event. Acute event show severity in 16 minutes. Subacute 1 day or 24 hours, or latent show 2 days. Second type depending upon the type of reaction. Type 1 reaction, type B reaction, type C means chemical reaction, type D means delay reaction, type E reaction means exit reaction, type G means toxicity reaction, type H means hypersensitivity reaction, and type U means any classify. Third point is severity. Severity are further classified into three types: minor, moderate or severe, and other. The last point is other, depending upon the other adverse drug reaction. For example, side effect, secondary effect, toxicity effect, drug interaction, drug food interaction, drug allergy, drug reaction, drug withdrawal, drug dependent, etc. Then classification of adverse event will and broad. First, type A reaction. In type A reaction which can be predict from the known pharmacology of the drug. This reaction is called as the dose dependent, can be elevated by the dose reduction. For example, uh, type A reaction, for example, anti-inflammatory drug paracetamol, antihypertension drug, ACE inhibitor, etc. Next, second type is type B reaction. In type B reaction cannot be predicted from the pharmacology of the drug. This type is known as the not dose dependent. Dose dependent factor important in predisposition. For example, penicillin, anticoagulant drug. Anticoagulant means hypersensitivity drug. Third type is type C, means chemical reaction. Biological characteristic can be predicted from the chemical structure of the drug and metabolism. Example, paracetamol, hepatotoxicity. Fourth, type D means delay reaction occur after many years of the treatment is known as the type D reaction means delay reaction. Can be due to accumulation. Example, chemotherapy secondary tumor using secondary tumor analgesic neuropathy. Fifth is type E, end of the treatment reaction. This reaction occur when withdrawal is special when drug is stop. This reaction is occur. Example, phenytoin withdraw in seizure. Steroid withdraw, adrenocortico insufficient. Classification, next is classification of the adverse event depending on the severity. First is minor adverse drug reaction, no therapy, antidote or prolongation, and no therapy, antidote or prolongation is required. The second point is minor झालं. Second, moderate adverse drug reaction required change in drug therapy, especially treatment for prolonged hospitalization, stay by at least 1 day in hospital. Last is severe. Severe means the required hospitalization. Patient required hospitalization for 2 to 3 days. Potentially life-threatening condition cause permanent damage or occur in intensive medical treatment. Medical treatment is required is called as the severe reaction. And then adverse event are classified into 4 types. Adverse event are classified into 4 types. First is intensity, second is severity, third is causality. Intensity divided into further 3 types: mild intensity, moderate intensity, severe intensity. Causality divided into further 2 types: relative causality and unrelative causality. Severity further divided into 2 types: severe event or non-severe event. And it third type is predictability. Causal disease predictable or disease non-predictable. Thank you.